Hi, Mrs. Alvarez. My name is Jamie. I'm going to be your nurse today. I reviewed your records, and it shows that you are due for a dressing change for your wound. Is it okay if I go ahead and do that?
Yeah, that's fine.
Okay. I'm going to start by performing hand hygiene and then putting on my PPE, starting with my gown.
And now I'm going to take my Q-tip and apply it with the medication. Apply it around the incision. Once the scope of this,
Does this have to drop or can I take it out? You can take it out.
And you said you have like a 1-inch little
Okay, and then I'm going to put on my mask.
of this, now I'm gonna go ahead, take one gauze pad, up here, and then I'm gonna take another gauze pad.
Just trying to like open it up in the air. Yeah, it's
I'm gonna go ahead and take my abdominal
Can I
pad.
shake it?
I'm gonna go ahead and do my tape sleeve.
Can't be sure.
Take all the sides down.
I'm putting on my goggles. Okay, can you state your full name and date of birth?
Kimberly Alvarez, January 17, 2003.
Okay, thank you so much. I'm going to now identify the need for any analgesics. There is no need, so I'm going to now close the curtain. All right, and then I'm going to explain the procedure to you. What I'm going to do is I'm going to remove your old dressing and then apply a new one, and I'm also going to be making sure that everything looks okay, nothing's abnormal. So I'm going to make sure that I have my waste basket and then gather all of my supplies. And then I'm going to raise the bed to waist height or elbow height. Okay, I'm going to put on my gloves. And I'm going to expose the wound, making sure they stay covered. All right, I'm going to identify any tubes or drains. There are none. Okay, and then I'm going to, by using the push-pull method, I'm going to remove this dressing, making sure to remove the corners first. Okay, and then removing the sides and removing the dressing. I'm now going to inspect the dressing for taco, so any type of drainage, amount, color, or odor, and there is no taco present. It is clean. Going to throw that away. I'm now going to be inspecting the wound itself, so I'm looking for any drainage, erythema, edema, swelling, or bruising. None of that is present other than the erythema. Staples are used for the wound. Now I'm going to measure. Wound is 8 centimeters long and 1 centimeter wide, and depth is not necessary for this wound. Okay, now I'm going to take off my gloves. And I'm going to begin setting up my sterile field, starting with the drape and opening away from me. Throwing that away. And making sure to open this away from me while still maintaining sterility and not touching the sterile part. So I have a 1-inch border and not reaching across. Okay, and now I'm going to open up my supplies and remaining 6 inches above, opening away from me, 6 inches above. Okay, and then opening up my ointment. And then preparing 5 pieces of tape. One, making sure they are long enough to cover the sides. 1, 2, 3. 4. And then writing the date, time, and my initials. So it is 01/26/23. It is currently 11:50, and my initials. Okay, and having that set to the side, I'm gonna dog ear my tape for later use. And now I'm going to apply my sterile gloves, making sure not to turn my back to my sterile field or the wound, while still maintaining sterility. All right, putting on my dominant hand first. Okay, and maintaining. I'm now going to throw this away. Maintaining sterility. I'm going to set up my sterile field. Making sure the blue line is up. Okay. And now I'm going to begin by taking my cotton swab, getting ointment on it, placing it on 1/2. Okay, and then throwing that away. And then taking this, getting more ointment, and applying, dropping, making sure to keep my hands above waist height, taking my 2 4x4 gauze, placing it on top of the wound, glue line up, applying it like so, and then I'm taking my 4 pieces of tape and applying it to all 4 sides. So 1, and then 2, and then 3, and then 4. And then I'm going to take my tape that has my initials, date, and time on it and just stick it right on there. Okay, and now I'm going to remove my sterile gloves. Okay, and then I'm going to throw away my supplies. And then I'm going to cover the patient back up. Make sure that they are comfortable. How does it feel? Good, okay, I'm now going to lower the bed back down. Make sure the handrails are up. Okay, I'm going to remove my PPE. Throw that away. Remove my goggles. Remove my mask. Okay, Mrs. Alvarez. And we will make sure to get you a dressing change at least once every shift. If you need anything, feel free to press your call button. Have a good day. Thank you for allowing me to do this. Change your dressing.
Thank you.